going to go to Françoise Kemp. Françoise, how nice to have you with us. I've been with you before when you've been talking about modelling, but modelling of COVID in Luxembourg. Modellers have taken some, well, in the UK at least, modellers have had some bricks thrown at them because of the models of COVID. But they've been, you know, modelling is just so important and has been such a tool in this pandemic. So tell us more about what happened in Luxembourg.
Okay. You probably remember March 2020 when COVID started and everybody was put into lockdown. Everybody was stuck at home, and the World Health Organization on the 19th of March declared COVID-19 as a pandemic. And with that, it started. In fact, why do we have this issue? We have this issue due to global traveling, urban migration, and of course, also the growth of population. That's the issue why we have kind of pandemics and infectious disease spreading more around than before. But at the same time, it is a new challenge. And maybe not in a positive sense, I would more say in a negative sense, because doctors have fast to invent a way to rescue people, to find medication, treatments, and so on. But also epidemiologists have a huge challenge in order to understand how the disease spread. And it's that what we want to model, how the disease spread in a population. The key aspects in order to understand and to go through this modeling process is, of course, the latent period. And what it is, it's quite easy. It's the moment when a person got infected, and it takes some time, of course, to get infectious. Then, of course, that is similar to what we also then see in the model in order to get an idea if a person today got infected. Of course, it's not today already spreading around, but it will be in 5 days infectious and spread the virus around. And then one further important tool and important key parameter is the clinical signs. When does this person, in a really severe case, enter hospital and ICU? Because modelers want to know how many health people are needed, need to be prepared, how many beds should be prepared. It's a question of being prepared. And especially in epidemiologists, you have days in advance, and you can project and find out how many people will enter hospital and ICU in the next days. So now, my type was about modeling in Luxembourg. These are the numbers of Luxembourg. So we had 200,000 people got infected in Luxembourg with COVID-19, and sadly 1,015 died of it. Meaning that every third person in this room and every third person in the population had COVID-19, at least in Luxembourg. And 0.5% died of it in Luxembourg. But what is the model now about? Or how does the model look like? In fact, it has, as already said, to take into account the latent period, the incubation period, and as well the clinical signs. And now one key parameter comes in. It's the social interaction. How much people interact with each other, how much spreading, and how much they go around, of course. And that's where it starts, in fact, the model. It all depends on us. And then, of course, the testing. Everything is linked to getting tested positive and then get isolated in order not to continue spreading and being the wet person, spreading the virus around. Yeah, and of course, then what we want to find out how many beds in ICU and hospital are needed in order to protect people and hopefully get them the accurate treatment so that they're not going to die. What is mathematical modeling in that case then about? It's about understanding the disease dynamics. Of course, below, you may probably saw this figure at least 1,000 times. It's the waves of Luxembourg until yesterday, and how it's continuous spreading, and how many waves we in fact had during the last 2 years. But also mathematical modeling is about evaluating potential control strategies. What do I mean by that? Of course, masks we learned protect us and also reduce, in my model, the social interaction, as well as lockdown, of course. If nobody interacts with each other, of course, nobody can get infected because everybody stays at home and is alone or with his family. But furthermore, modeling is also about predicting future outbreaks, because due to the issue of globalization, we will have, sadly, future outbreaks, of course. But mathematical modeling is in fact a tool which is able to guide decisions and decision makers in order to help them give an impact on how political people should take measures, in which case, how they look like, what they want to do, if they should act in a sense of re-putting masks, for example. In fact, that's epidemiological modeling. It gives a hint to the politicals in order to say what they should do next. So in fact, mathematical modeling in this case is about guiding decision makers and give them good ideas what they can do, but just always under the assumption that we can do projections in a short time period, and of course under the underlying assumptions of that moment when you have done that. So mathematical modeling is guiding decision makers, but not dictating which decision they should take.
Thank you. Stay there. Sorry, having a fight with my sound system here. That was so interesting. And I think that one of the issues for the public is that they didn't understand what mathematical modeling was. So they didn't understand that it was what could happen, not what would happen. And there are all sorts of things going on in that scenario where it's changing. So the very fact that the numbers are going up makes people stay at home. And they do that without government telling them to do that. They just think, oh, I don't like this very much, and they stay at home more. So so there's a lot of public communication. Did you do much radio and television? Stefan, get her on the radio and television immediately. It's really important for the public to understand it. I noticed that you had a very little line at the end. COVID is now going up enormously again, absolutely huge, at a time when we've all dropped all